I want to make sure everyone's really clear on the definition of addiction, which is a chronic medical disease, a relapsing and remitting disease of the brain that results in compulsive drug seeking and use, despite harm to the person using and to those around him or her. And yet of the 23 million Americans with substance use disorder, only 10% access treatment. We need effective interventions. So I offer to you 3 ideas, strategies as public health champions. I could fill this slide with probably 20 different ideas, but let's start with these 3. We need to really reduce the stigma that's pathologically associated with addiction. So what is stigma? It's any type of attribute, behavior, condition that's socially discrediting. So remember what I just said, right? 23 million Americans with substance use disorder, only 10% access treatment. Stigma is a major barrier to seeking help. And according to the World Health Organization, drug addiction is the #1 most stigmatized social problem, more than mental illness, more than alcohol. So I offer to you a simple yet effective way to reduce stigma. And it's something that we can all pay forward. Studies show that when we use stigmatizing, punitive, tough language like substance abuser, drug abuse, war on drugs, dirty urine, junkie, cokehead, lush, addict, studies show that patients self-stigmatize. Patients are less likely to seek help, and they're more likely to perceive discrimination. In addition, studies show that when healthcare professionals hear these words, they have less regard with people with addiction, for people with addiction. They label them as being less motivated, angry, violent, manipulative. And they spend shorter time in clinics with them. And all of this adds to suboptimal care. So as an alternative, studies show that when we use less punitive language, less stigmatizing language, such as a person with substance use disorder, a person with substance use issues, your urine is positive for opioids. Studies show that when we use this type of language that's less judgmental, more compassionate, patients actually are more likely to, feel respected, they feel less judged, and it improves the relationship between the clinician and the patient or client, and they are more likely to seek care. Another idea and strategy I think is really important is the idea of widespread naloxone, and in doing so in a creative and yet pervasive, widely accessible way. So every time a patient gets an opioid prescription, and by the way, opioid medications are still clinically indicated for many patients who have acute and chronic pain. But every time that patient gets that prescription for a Percocet, Vicodin, Dilaudid, they need to also get nasal Narcan or some type of naloxone. In addition, so that's on the individual level, then on the community level, we need to make sure that naloxone is widely accessible out in the communities. You guys know AEDs, right? Everyone knows what a defibrillator is, an AED is. They're in schools, they're in airports. We need to do the same thing with naloxone. And in fact, a group in Rhode Island has already created what's called the Nalox box. In order to do this and be successful, we need to make sure there's widespread naloxone training in the community. Last, and most certainly not least, as a strategy for really helping people and saving lives, is we need to really reduce this egregious treatment gap. And that is, a major way to do so is by offering medications which then allow recovery. So the data is very clear. Medications for addiction treatments such as methadone, buprenorphine, and more recently naltrexone have been shown to reduce relapse, reduce overdose deaths, reduce healthcare and criminal justice costs. That data is very, very clear. And yet only 20% of people with opioid use disorder get access to this evidence-based treatment.